Tarsorrhaphy is one of my favorite procedures because I feel like patients get a big return on a relatively small investment. What do I mean by that? So tarsorrhaphy is a procedure in which a dissolving suture is placed in the very, very far corner of the eyelid laterally, so towards the ear. And what this can achieve is an upturning of the lower lid and an overall kind of shortening of the palpebral fissure. That's the kind of space with which the globe or eyeball protrudes. And this is really nice for cases of asymmetry. If somebody has one eye that appears larger than the other, this is really good for folks who want just a lift in the corner, so the lateral canthus or the outer corners turn up just a bit. And this is nice because it's actually a reversible procedure. So not many surgical procedures are reversible. This one can be, and that's because it's done in the kind of mucous membrane portion of the eyelid. So there's actually no cutting of the skin, so to speak. It's rather a freshening up of the mucous membrane in the corner. Kind of think of that space behind your eyelashes, and a small dissolving suture is placed in a circular fashion in that corner and then dissolves over time.
So I'm just curious, not that you would probably want somebody to approach it this way, but it's like, take up a little bit more, and then you know what, can we go a little more? But that is possible.
It is possible.
Wow, it
is possible. And shortening the tarsorrhaphy or undoing a portion of it is a relatively straightforward procedure too.
That's pretty. And how
done
long?
In the office.
Done in the office, so
yes.
It's an office visit, in and out, and
almost all of our procedures can be done in the office, and that's why we kind of want to get this point across about the lunchtime lift. Yeah. It might not mean you go right back to work.
I never heard of that. But
yeah. But we want to impart that a lot of these procedures are 30, 40 minutes to do, and almost all of them we can do in the office. And we found that folks really respond to that simplicity.
That's nice.
Obviously, we want to have the very highest standards. So we also have a surgical center where we can take people who want to go to sleep. But we found that many folks just like the idea of having a family member drive them, taking a relaxing pill, having procedures done in the office, and kind of cutting out the whole going to a hospital, going to a surgery center, starting an IV.
There's definitely, that's an
hours and hours
thing.
of.
Hey, can I ask this particular procedure? Is there? You said they can walk out. Is there any evidence? I mean, is there any swelling or anything, or is it like you wouldn't even know?
Yeah, most procedures have some swelling, some bruising, but it's typically pretty limited.
Yeah, that's pretty nice. Mm-hmm. So,
and there's techniques we have to minimize the swelling and bruising and things like that. We can go over that during one's consultation. There's some medications we can do. There's some medications we can avoid. And then there's things like ice and ointment that really can help with that healing process.